I'm Lauren Dalton, and I'm here to talk about the management of neuropathic pain. Pain is a universal experience, and it's one of the most frequent reasons for physician consultation in the United States today. 1 in 3 Americans suffer from chronic pain. Chronic pain is more prevalent than diabetes, heart disease, and cancer combined. The Institute of Medicine called for improvement in curriculum and education for healthcare professionals regarding chronic pain. Although nurses work with patients with neuropathic pain symptoms every day, most have no training in neuropathic pain management. Based on answers to a questionnaire in my article, it said that 80% of nurses were unable to define neuropathic pain, and 83.8% were unable to cite diseases that cause neuropathic pain, and 90% showed insufficient knowledge regarding neuropathic pain management. So that's what we're going to talk about today, the management of neuropathic pain. Nurses, we play a very integral role in pain assessment and management by listening to our patients, communicating with them, educating them, and collaborating with the healthcare providers, being our patient advocate and talking for them. Despite all of the improvements in pain assessments and prompt treatment, shortfalls persist in pain management, education, knowledge, and attitudes. So we're going to talk about pain now. Can anybody tell me what pain is?
Something that makes you go, ow!
It hurts.
Okay. Pain is actually an unpleasant sensory and emotional experience associated with actual or potential tissue damage. It's a complex phenomenon that may function as a protective mechanism to an unpleasant stimulus, such as moving your hand off a hot eye on the stove because it hurts. Your body's telling you to move it. It also can be maladaptive, such as occurs in neuropathic pain, and that's what we're going to talk about next. So what is neuropathic pain? Does anybody know?
Not knowing that your body's being hurt.
Okay. Neuropathic pain, it does not serve a protective purpose. Like what we talked about earlier when moving your hand away from the hot eye on the stove. It's a complex chronic pain state that is usually accompanied by tissue injury from injuries, perfusion, or disease processes. The nerve fibers may be damaged, dysfunctional, or injured, which sends incorrect signals to other pain centers. Damaged nerves have increased excitability and fire spontaneously, creating pain signals without a stimulus. So you're feeling pain you don't understand why you're feeling the pain. There are different classifications of neuropathic pain, and I'm going to give you some examples of those. And on your handouts, there should be a chart, I think it's table 2, that has the classifications with some examples. So you have, one of the classifications is toxic, and that's can be from chemo radiation. And then you're going to have your metabolic, and that's going to be from diabetic neuropathy. Trauma, that can be from phantom limb pain or spinal cord injury. Then you have compressive from carpal tunnel syndrome or compartment syndrome. And then you have autoimmune from multiple sclerosis, because we know that this disease, it eats away the protective covering of the nerves. And then you have viral from the varicella zoster virus, HIV, and Guillain-Barré syndrome. And then you have mixed, which is chronic regional pain syndrome. Okay? So neuropathic pain symptoms. Patients with neuropathic pain, they describe their pain as a constant burning or shooting or like an electric pain, like a shock. It can be a stimulus evoked by temperature or light or touch. Even the gentlest touch can cause really bad pain for people who have neuropathic pain. Other related symptoms include numbness and the reduction or absence of thermal, vibratory, or tactile sensation. My dad actually has trigeminal neuralgia, and I asked him how he would describe his pain, or how he describes it to the doctors, and he says he describes his pain as a constant brain freeze, or someone or somebody just constantly smashing his face in. So that's tough for him. He has bad days, he has good days. But and trigeminal neuralgia is actually a chronic pain condition which encompasses neuropathic pain. So that's how that correlates. And what can cause neuropathic pain? The changes in the peripheral and central nervous systems can cause neuropathic pain. Do y'all know any disease processes that can cause neuropathic pain? Or that follow neuropathic pain?
Cancer?
Cancer could be, yeah. Trigeminal neuralgia, like what I just talked about, post-herpetic neuralgia, diabetic neuropathic pain, central post-stroke syndrome, and neuropathic cancer pain. So those are all diseases that encompass neuropathic pain. So how exactly is neuropathic pain diagnosed? The healthcare provider will conduct an interview to obtain a history and physical examination. The healthcare provider will also ask some questions about the pain, such as where is your pain? Describe your pain. What triggers your pain and how long does your pain last? Also, along with the initial interview, a blood and nerve test may also be performed. So, how can a nurse assess a patient with neuropathic pain? And this is the main thing that we want to talk about today is the assessment and pain management with treatment and medication. So, to better provide patient care, nurses should be familiar with the neuropathic pain clinical assessment tool. And there's actually 5 of them, and they basically all just ask the same questions like the healthcare provider asked in the initial assessment, where's your pain, where is it located, how long does it last? The 4 clinical tools are the DN4 questionnaire, and then you have the LANS questionnaire, you have the pain detect questionnaire, and you have the NPQ, and then ID pain. And in your handout, there's also some examples of those that you can take with you. These questions and the questionnaires, they will also help you assess, they also help you diagnose neuropathic pain, but they also help you assess how well the pain is being managed by the treatment. Nurses play a very important role in the patient's education and is able to assess treatment side effects with these also. When administering medication, the nurse must know the rationale for each drug's use. For example, patients with neuropathic pain commonly receive antidepressants and anti-seizure medications, but they may have no history of epilepsy or depression. So the treatment for neuropathic pain are adjuvant analgesics, and they are the foundation of neuropathic pain management. Their primary indication is unrelated to managing pain, but it does provide an analgesic effect. Antidepressants, anti-seizure medications, muscle relaxants, sedatives, steroids, and analytic medications are all common adjunctive analgesics. A patient is unlikely to experience total pain management with any treatment, so the goal of therapy is decreased pain sensations and functional rehabilitation. On the handout I gave you, I think it's table 3, it has the most common medications prescribed to treat neuropathic pain along with indications and side effects. So that'll be a little handy thing whenever you have a patient with one of these diagnoses. So let's take a look at some of those medicines. Let's see. You're going to have your first line agents, and then you're going to have your second line agents. And your first line agents are going to be your antidepressants and anti-seizure medications. You're going to have your TCAs, which you're going to have amitriptyline and imipramine. And you're going to have your SNRIs, which you're going to have Cymbalta as one of those as well. And then another first line agent is gabapentin. And then you're going to have a topical lidocaine. And the topical lidocaine, they're going to be patches, and they're applied directly over the painful area. So they shouldn't have any more than 4 patches a day, and each patch should be removed after 12 hours. And the second line agents, they're going to be more of your strong opioids, like oxycodone, morphine, methadone. Those are all the strong opioids, but oxycodone is the most studied opioid for neuropathic pain management. So in conclusion, because most medications used in treatment of neuropathic pain, neuropathic pain management are adjunctives. Nurses must de-alienate the rationale for medications administered. Okay, so we're going to go over those 3 questions I asked again. Can anybody tell me what pain is?
So unpleasant sensory experience that has like a protective purpose.
Yeah.
Like whenever you put your hand on the stove.
Good, yes. And can y'all tell me what neuropathic pain is?
It does not serve a protective purpose.
Good job, yes. And could y'all, can y'all name some diseases that encompass neuropathic pain?
Phantom limb.
Diabetes.
Cancer.
Post-stroke.
Y'all are awesome. Good. Thanks for listening to me. That's all I have for you today.